So Efgartigimod, an FcRn inhibitor, the second new class of drugs to treat myasthenia in the last few years, was designed to be cyclically dosed for two reasons. One, because patients wanted it. In focus group discussions with that population suggested they wanted to be treated when they had to be treated, not on an ongoing basis. The second reason it was designed that way is to look at the durability of response. And what was found in the ADAPT trial was that half the patients had improved benefit by trial criteria in excess of 8 weeks. A third of them went in excess of 12 weeks, much longer than what we typically see with intravenous immunoglobulin, sub-Q immunoglobulin, therapeutic apheresis, plasma exchange, if you will. And so we're now starting to see what we would consider as precision medicine, in that one would treat the patient when they needed to be treated, rather than having to administer it on an ongoing basis. So it's an option for patients. And there are clearly those patients who would prefer this approach. There'll be other patients who prefer another approach. But we're now starting to see the betterment, if you will, in terms of our ability to meet the needs of the individual patient. Both drug classes, complement inhibition, FcR inhibition, have a side effect profile that is much better than any of our standard of care drugs. When we look at dissatisfaction surveys, for instance, the number one area of dissatisfaction is that the adverse event profiles. And if we look across all treatments, it's around a third of patients. If we look at corticosteroids, 80% of them are very dissatisfied because of the side effect profiles they experience. Drugs like Efgartigimod, with very narrow, very nominal side effect profiles, are a welcome to the myasthenia population. The second aspect is the rapidity with which drugs work. On average, our current standard of care therapeutics take some 4 to 6 months on average to begin working, not to have substantial effect, but just to begin. And one of them will take 10 to 12 months. And here we're seeing responses in the matter of 1, 2, 3 weeks, which is far faster than anything we have. And again, a welcome addition to our patient's ability to be treated.